Have you ever heard someone say, "I was admitted to the hospital," only to find out later that they were never technically admitted at all? That sounds confusing, but it happens every day. You may be in a hospital bed. You may be wearing a hospital gown. You may have an IV, labs, imaging, medications, nurses checking on you, and doctors seeing you. You may even stay overnight. But from an insurance standpoint, you still may be considered outpatient under something called observation status. And that difference can have a major impact on your bill, your coverage, and even whether Medicare will cover rehab after your hospital stay. Today we're talking about observation versus inpatient status, what it means, why it matters, and what patients and families need to ask before leaving the hospital. Welcome back to LI Aftercare. I am Dr. Brennan, an internal medicine physician, and my goal is to make the hospital journey less confusing for patients and families. Let's break this down in plain English. Observation status means the hospital is watching you closely to decide whether you are safe to go home or whether you need to be formally admitted as an inpatient. You are still receiving real medical care. Observation does not mean nothing is wrong. It does not mean your symptoms are being ignored. It does not mean you are just sitting there waiting. You may be getting IV fluids, antibiotics, cardiac monitoring, CT scans, MRIs, blood tests, consults, and frequent reassessments. But technically, observation is usually billed as outpatient hospital care. Inpatient status is different. Inpatient status generally means the doctor has written an order to formally admit you to the hospital because your condition requires hospital-level care beyond a short period of evaluation and treatment. Here's the key point. Your hospital location does not always determine your status. Your room does not determine your status. Sleeping overnight in the hospital does not automatically make you inpatient. The order, the medical necessity, the expected length of care, and your insurance rules all matter. Now let's use an example. A patient comes to the emergency room with chest pain. The first EKG does not show a heart attack. The first blood test is okay, but the doctor is not comfortable sending the patient home yet. So the patient is placed in observation. The hospital may repeat cardiac enzymes, monitor the heart rhythm, order a stress test, get an echocardiogram, or ask cardiology to evaluate. If everything looks reassuring, the patient may go home the next day. That may remain an observation stay. But if the patient is found to have a heart attack, unstable symptoms, serious rhythm problems, heart failure, or another condition requiring inpatient level treatment, the status may change to inpatient. Another example, a patient comes in dizzy, weak, dehydrated, or with abnormal labs. The emergency room doctor may not know right away whether this is something that can be corrected quickly or whether the patient needs several days of treatment. Observation gives the medical team time to evaluate, treat, and decide the safest next step. Now here's where many patients get surprised. Observation versus inpatient status can affect how your insurance pays. For Medicare patients, inpatient hospital care is generally covered under Medicare Part A. Observation and other outpatient hospital services are generally covered under Medicare Part B. That difference may affect deductibles, coinsurance, medication coverage, and follow-up care. And one of the biggest issues is skilled nursing facility coverage. Many patients assume I stayed in the hospital for 3 days, so Medicare should cover rehab. But that is not always true. For traditional Medicare to qualify for Medicare-covered skilled nursing facility care, patients generally need a qualifying 3-day inpatient hospital stay. Observation days usually do not count toward that 3-day inpatient requirement. So a patient could be in the hospital for 3 nights under observation and still not meet the Medicare inpatient 3-day requirement for skilled nursing facility coverage. That can be shocking for patients and families. This is why the words matter. Hospital stay and inpatient stay are not always the same thing. You can stay in the hospital and still be outpatient. That is the part many people do not realize until they get a bill or until discharge planning starts. Now, if you are a Medicare patient and you are in observation for more than 24 hours, the hospital is required to give you a Medicare outpatient observation notice, often called the MOON. The MOON explains that you are receiving observation services as an outpatient and not as an inpatient. Please do not ignore that form. Read it, ask questions, ask what your current status is, ask whether your status has changed, ask how this may affect your coverage, medications, rehab options, or out-of-pocket costs. Here are the questions patients and families should ask during the hospital stay. Number 1, am I inpatient or observation? Number 2, has a formal inpatient admission order been written? Number 3, if I'm observation, what has to happen for me to become inpatient? Number 4, if I need rehab, will this stay qualify under my insurance? Number 5, can I speak with case management or social work before discharge? Number 6, can someone explain how my insurance may cover this stay? These questions are not rude. They are important. You are allowed to ask. You should ask. And you should ask early, not after the discharge papers are already printed. Now let's also be fair to the medical team. Doctors do not simply pick observation or inpatient status randomly. Hospitals have rules. Insurance companies have rules. Medicare has rules. Medical necessity matters. Documentation matters. Expected length of stay matters. Severity of illness matters. Intensity of services matters. Sometimes, even when a doctor believes a patient is sick, the insurance criteria may still place that patient under observation unless the situation clearly supports inpatient admission. That is frustrating for patients. It is frustrating for families. And honestly, it can be frustrating for doctors too. The most important thing is communication. If you are the patient or family member, do not just ask, are we admitted? Ask specifically, are we inpatient or are we observation? Those are not always the same thing. Also remember that status can change. A patient may start an observation and later become inpatient if the condition worsens or if the medical picture shows that inpatient level care is needed. A patient may also start as inpatient and later have the status reviewed or changed depending on insurance and documentation. So keep asking. Before discharge, ask again. What was my final status for this hospital stay? That question matters. Now let's talk about medications. When you are inpatient, many medications are typically included as part of the inpatient hospital stay. But under observation, because it is outpatient status, there may be different billing rules for certain medications, especially medications that Medicare or your plan may consider self-administered. This can create unexpected charges. So if you see a bill that does not make sense, ask for an itemized bill. Ask the hospital billing department to explain the charges. Ask your insurance company how the stay was processed. And if you believe something is wrong, ask about appeal options. Now, for Medicare Advantage plans and commercial insurance plans, the rules may be different. Some plans have their own criteria, prior authorization requirements, rehab rules, and cost-sharing structures. So this video is not a substitute for calling your insurance plan, but it should give you the right questions to ask. Here's the bottom line. Observation status is real hospital care, but it is often considered outpatient care. Inpatient status usually requires a formal admission order and must meet medical necessity criteria. Staying overnight does not automatically mean you are inpatient. Observation days may not count toward Medicare's 3-day inpatient requirement for skilled nursing facility coverage. And if you are not sure what your status is, ask. Ask early, ask clearly, and ask before discharge, because understanding your status can help you avoid surprises, plan for rehab, understand your bill, and make safer discharge decisions. If you found this helpful, please like this video, subscribe to LA Aftercare, and share it with someone who has a loved one in the hospital. My goal is to help patients and families understand the hospital system before they are overwhelmed by it. Thanks for watching, and I'll see you in the next video. Please subscribe, follow, share, and like on all our social media platforms.